It is widely accepted in the health service that there is real value to offering certain treatments outside the hospital environment. It can take pressure off hospital beds and other acute services, remove patient anxieties, and can sometimes offer significant cost savings.
Well, I think the medical team generally, feel that this, is a worthwhile service as well. Certainly, it frees up the doctors and nurses in the day ward, that instead of these patients coming on a very regular, frequent basis, that instead we now only see them maybe every 3 or 4 weeks for critical checkups before they go ahead with their next cycle of treatment.
Patients being treated can spend up to 6 hours in the hospital, waiting for testing, reviewing by a consultant doctor, and dispensing and administration of the medicine. For a lot of patients, travel to the hospital is quite a burden and adds considerably to their anxiety.
For our natural catchment area, we could be seeing patients from as far afield as Belmullet up in northwest Mayo or Ballinav, for example. And for patients making a trip down to Galway, that could take well over 2 hours. And then the waiting around to be seen by and assessed by the doctor and have bloods, etc. It all adds up to a full day and an early start and late to bed for the patient, which isn't what a cancer patient should be going through.
TCP Homecare have developed and delivered a number of IV therapies in the home services in Ireland. These services include IV antibiotics in the home, which facilitate early discharge of patients from acute hospital wards, and also chemotherapy in the home.
We are able to provide a one-stop shop for the management of patients in the home. This includes pharmacy, waste management, nurse-led services, and electronic patient management systems.
IV therapy in the home services requires integrated processes and procedures to enable the seamless transfer of patients to the home care provider. TCP Homecare have put a number of processes in place which facilitates the easy transfer of patients to home IV infusions.
I suppose TCP Homecare, what we try to achieve is to deliver services to a very high standard, where basically I suppose one of the key elements is that it's a nurse-led service. The patient remains in the care of the consultant at all times. Our service is really, I suppose, an extension of the hospital care that the patient would alternatively be getting.
We have a lot of time for patients. We would allocate each of our visits very carefully to ensure that we have enough time to actually sit with the patient, explain what the service is about, allow the patient the time to actually ask any questions that they may have. And then while we're actually doing the infusion, that is patient dedicated time, so that you actually have, be it a half an hour, we have that time with that patient.
Once the patient is identified on the hospital ward that is suitable for home administration of therapy, I suppose the paperwork involved is that the patient must be referred to our services by the treating consultant or his team. On receipt of the referral, our customer services people will record all of the details relating to that patient. That patient is then assigned to a nurse within their own geographical area. All of the details relating to that patient is sent down to our nurse's handheld PDA device. And basically what this enables us to do is that each nurse has a record of each individual patient and all of the details relating to that patient and their treatment, and that information is available on the home visit.
I recently went to visit this elderly gentleman who lived on his own in rural Ireland. He was not in mileage, not a huge distance from the hospital. However, when he actually sat down to tell me about his journey to the hospital, this gentleman, to go to hospital for a procedure that took approximately 15 minutes from beginning to end, had to leave home at 5 a.m. He had to take 3 bus journeys and then walk. He had about a mile and a half to walk. Whereas this gentleman, we were able to go out to him, come to his home at a time that was convenient to him. He could have his treatment there beside his fire, and we were away again without all that added stress and pressure which he really didn't need. This man doesn't have a huge amount of time, and he said the time he wants to spend at home.
The bottom line is the patients feel that they are getting the best of care but not jeopardising their overall management because they are still in constant contact with their treating team or treating consultant.
We have had experience of the current providers, TCP, and we've been happy with the service that they have provided, and that has built up a certain level of trust. Overall, I think this has been a very positive experience. I think there's a whole host of reasons from patient satisfaction. There is certainly no question that efficacy is in any way compromised by using this approach as opposed to delivering the treatment in hospital. It reduces the throughput through our day ward, which is, I think, very important, not least in terms of reducing the risk of hospital-acquired infection, so that these patients who are sick, vulnerable patients, spend as little time in hospital, they get their treatment delivered at home, they enjoy good quality of life, and they only come into hospital when they really need to.